Hello, my name is Timothy Simpson. I'm a registered nurse. I've been a nurse for around 15 years. I've worked in the surgical ICU pretty much my whole nursing career since I graduated nursing. I chose motivation to be my topic to discuss for my leadership conference assignment. I guess I would start with whenever I first graduated as a nurse and started working in the intensive care unit, which some people don't suggest. I had a preceptor named Diana who pretty much motivated me and to learn as much as I could. And she really made you think and critically think and solve problems and not just rely on being task oriented and learning how to just give meds or take patients to tests or CAT scans or procedures, whatever. She pretty much had you think outside the box and look at the whole picture, look at all the different systems. And she motivated me to really think about every little thing I was doing and what was involved. That way I could learn more. And then she always encouraged me to join groups like AACN. Later I went ahead and completed my CCRN and got that certification done for critical care nursing. So she was just really inspiring, and she did teach me a lot, which definitely helped me out. And now 15 years later, I'm in charge of a surgical ICU at Winter Haven Hospital. So I try to use some of those same techniques to motivate some of our staff, because a lot of times there could be poor workplace conditions where nurses are overworked or stressed, or they just don't feel happy at work. And so you need to motivate these nurses to, have a vision to follow, pretty much to reach the goals they want to, so that way they're satisfied with their jobs and they're happy, because with patient care, the nurses need to be satisfied with their job so they do a good job and they pay attention. And I just believe overall the staff and everybody, the well-being of everybody in the workplace is a lot better. So I always encourage the staff to also continue to learn as much as they can, study EKG rhythms, learn as much as they can about the disease processes or anything that's going on with their particular patients, to look up everything, read x-rays, read the reports. That way when they speak to the physicians, they know more about what's going on with their patient rather than just the small tasks. And I think the physicians definitely appreciate it whenever the nurses know more about what's going on with the patients. And sometimes you have some nurses that don't really seem to care to learn more, or maybe they're afraid or they're intimidated. I try to engage them into learning more and just pushing themselves, following a vision of the patient outcome, just being overall better care in the whole ICU. Everybody works together as a team. We help each other out. If anybody gets in the weeds, we kind of help each other get back. You just have to kind of figure out how motivated people are and their desire and willingness to actually do some of the things. I mean, sometimes we run into nurses who seem miserable. And so, we work with them for a little while, and if maybe ICU is not for them, so then maybe we just suggest maybe to go work in a different area, or we first, of course, we try to push them to exceed, but then sometimes it just doesn't work out. And so you have to know when to cut loose. But at the same time, until that point, we try to motivate them and push them as far as possible. And then whenever the nurses do a great job and they do start learning and they do show progress, it's definitely important that you reward your staff and recognize that they're doing a good job, so that way they'll continue to be motivated to keep excelling in whatever area it is that they're working in. So I guess that's about it. I mean, I would just suggest to keep on trying to gain as much knowledge as you can in whatever area you're working in. If you have poor workplace conditions, I chose an article that I'm going to cite that I cited with this assignment. And it talks about how a charge nurse, in a surgical unit went in and poor workplace conditions. And she went in and, really motivated her staff to do a better job and try to improve workplace conditions. And it definitely ultimately in the end just ends up with better patient care and nursing satisfaction. Then you have less nurses quitting and leaving, and the nursing retention is a lot better. So your work conditions are definitely a lot more positive and better for the patient. So motivation, definitely a big thing that needs to be addressed, definitely whenever you're in the field of nursing. Thanks.